Olopatadine Hcl Aerosol, spray with pump is used to relieve symptoms of seasonal allergies that occur in the nose, such as runny/itchy/stuffy nose, sneezing, and post-nasal drip. This medication is an antihistamine, which means it works by blocking certain natural substances called histamines that are responsible for allergic symptoms. It is important to note that you should not use this medication in children younger than 2 years unless specifically directed by the doctor. To decrease the risk for serious side effects, carefully follow all of the doctor's dosage directions. Also, do not give other cough and cold medication that might contain the same or similar ingredients. It's best to ask your doctor or pharmacist about other ways to relieve cough and cold symptoms, such as using saline nose drop/spray, using a humidifier, or using an infant nasal suction bulb. As for the daily dosage, it is important to follow your doctor's instructions. And it is recommended to use it at the optimal timing as directed by your doctor or pharmacist. Before you start using olopatadine, make sure to read the instructions provided by your pharmacist. And remember to follow the proper instructions on how to use this medication. If you have any questions, don't hesitate to ask your doctor or pharmacist. Make sure to prime the spray pump before using the bottle for the first time, and if you haven't used the medication for more than 7 days. Avoid spraying in your eyes or directly onto the nasal septum. Your doctor will usually direct you to use this medication twice a day in both nostrils. It's important to use it regularly to get the most benefit. Try to use it at the same times each day to help you remember. Keep track of the number of sprays you use, including test sprays used to prime the bottle. Once you've used the labeled number of sprays on the product package, discard the bottle, even if it's not completely empty. This ensures that you get the correct amount of drug in each spray. Remember to tell your doctor if your symptoms do not improve. Some common side effects of using Olopatadine Hcl Aerosol, spray with pump may include a bitter taste in the mouth, nosebleeds, or irritation in the nose. You may also experience drowsiness, although this is rare. If any of these effects persist or worsen, it's important to inform your doctor or pharmacist. To reduce the bitter taste, you can try sniffing gently through your nose after each spray, rather than breathing in deeply. It's important to remember that this medication has been prescribed to you because the benefit to you is greater than the risk of side effects. Many people using this medication do not experience serious side effects. You should contact your doctor immediately if you experience any serious side effects, such as sores in your nose or a hole in the nasal septum. While a serious allergic reaction to this drug is rare, seek medical help if you notice symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects, so if you notice any other effects not listed, be sure to contact your doctor or pharmacist. If you're in the US, you can call your doctor for medical advice about side effects, or report them to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can call your doctor for medical advice about side effects, or report them to Health Canada at 1-866-234-2345. Before using Olopatadine Hcl Aerosol, spray with pump, make sure to inform your doctor or pharmacist about any allergies you may have. This medication may contain inactive ingredients that can cause allergic reactions. Also, discuss your medical history with your healthcare provider before using this drug. This medication may rarely cause drowsiness, especially when combined with alcohol or marijuana, cannabis. Avoid driving or operating machinery until you know how this drug affects you. Limit your alcohol intake and talk to your doctor if you use marijuana, cannabis. If you are pregnant, only use this medication if it is clearly needed. Talk to your doctor about the potential risks and benefits. It is not known if this drug passes into breast milk, so consult your doctor before using this medication while breastfeeding. It's important to be aware of potential drug interactions with Olopatadine Hcl Aerosol, spray with pump. Certain medications may affect how this spray works or increase the risk of serious side effects. Be sure to keep a list of all the products you use and share it with your doctor and pharmacist. Always consult with your doctor before starting, stopping, or changing the dosage of any medicines. If you are taking other products that cause drowsiness, such as opioid pain or cough relievers, alcohol, marijuana, drugs for sleep or anxiety, muscle relaxants, or other antihistamines, make sure to inform your doctor or pharmacist. Also, check the labels on all your medicines, including allergy or cough and cold products, as they may contain ingredients that cause drowsiness. If you have any concerns, ask your pharmacist about using those products safely. If you or someone you know has taken too much Olopatadine HCl Aerosol, spray with pump and is experiencing severe symptoms such as passing out or difficulty breathing, it's important to seek immediate medical attention. In the US, you can call the local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. Symptoms of overdose in adults may include drowsiness, while in children, it may include restlessness/agitation followed by drowsiness. It's crucial to act quickly in the case of an overdose. This medication is for use in the eyes only. Do not use it on the skin or take it by mouth. Olopatadine ophthalmic, for the eyes, is used to treat itching, redness, and swelling of the eyes caused by allergic reactions. Olopatadine ophthalmic may also be used for purposes not listed in this medication guide. If you forget to use a dose, use it as soon as you remember. If it's almost time for your next dose, skip the missed dose and use your next dose at the regular time. Do not take a double dose to make up for the missed one. It's important to store Olopatadine HCl Aerosol, spray with pump at room temperature and keep it away from children and pets. Do not flush this medication down the toilet or pour it into a drain unless instructed to do so. When this product is expired or no longer needed, make sure to properly discard it. You can consult your pharmacist or local waste disposal company for more information on how to do this. Remember, always keep medications out of reach of children and pets. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.